Western Cape Health Department could be forced to freeze over 2,000 posts if the public sector wage deal is not funded. Well, government and unions agreed to hike the salaries following protests earlier this year. So let's find out why there is this concern about a post freeze, if you will. Let's bring in Western Cape Health MEC, Nomafrench and Mbombo, joining us this morning on the line. Good morning to you, MEC. I appreciate your time. So why are we here? What's happened?
Good morning, Gareth, and good morning to all the listeners. Yes, indeed, after the protest action where the Department of Public Service and Administration, they came to an agreement for 7.5% increase in wages. However, up to this stage, there's been no correspondence and communication from the National Treasury in regard to increase the budget. At this stage, it means that we have got an unfunded mandate from the Pretoria, and that is about 1.18 billion that impacts on our COEs, which is our total cost of employment. And when you look in terms of the figures, it means that it equates to about 2,362 posts. So in order to fund this 1.18 billion, it means that you have to freeze and also stop hiring the new people. Taking note that this comes when at the beginning of the year, we had a shortfall of 1.58 billion because of the decrease in our provincial equitable share and also in our conditional grants. However, the provincial treasury gave us about 1.48 billion to cover the shortfall so that we could be able to run the service. But there's been also a shortfall because the conditional grants were not taken care of. So when you have now a 1.1 shortfall because of the 7.5 increase, and then this adds to the layer of the shortfall from the beginning of the year, there's no way where you can get any, because there's no new money. Take into consideration that with the diesel that costs us more, because currently I'm load shedding, that's why I'm not on the video. And also with the inverters, with the solar panels and everything else, it means that you are running a service. We used to warn about the fiscal cliff. So the fiscal cliff that we used to warn about, it's here.
And it sounds like it's one step away from going over this fiscal cliff, MEC, as well. So is this an issue of Treasury having the money, it's just not being allocated, or does Treasury not have the money and they need to then find it and then allocate it? So which one do you think it is?
The National Health Minister this week presented his budget, which is, he acknowledged the fact that the health sector has been underfunded for the years, which is now it getting more. Taking note that during the COVID, there have been some additional monies where at least you could be able to fight COVID as well. That money also is no longer there. And that now it exposes that shortfall that even was there before the COVID. Because this doesn't only affect us, the Western Cape, it affects all the provinces. That now we have to absorb the 7.5 increase. Yet the National Treasury has not even communicated, and there's been no new money. Yet there's been already the decrease in the budget in the beginning of the year.
MEC, can you give me a sense of these 2,362 posts that you confirmed are probably going to be frozen? What sort of posts are we talking about? Are we talking about general staff, nurses? Today is International Nurses Day. Of course it is. Are we talking about doctors, specialists? Just give me a scale of the damage that this is going to cause.
What we have done is about our team has worked it out in regard to what is it, 1.186 billion, the shortfall on the cost of our employees, total cost of our employees, what it could be. So it's a combination of those that will make it up as a 1.186 billion. But also take into consideration at the beginning of the year, that shortfall of 1.5 billion because of the decree that even though the provincial treasury gave us extra money to make it up, there was still a gap, which meant that when you translate it It's about when you have a shortfall of about 300 for primary healthcare posts. So it's about just to illustrate in regard to when you have a 1.18 billion, what does it mean in real terms?
Yeah. No, I understand. I've got a sense of the maths, MEC. Forgive me, maybe I didn't phrase my question very well. Let me ask it again. I understand the maths behind this. What I'm asking is the posts that are probably going to be frozen. What kind of posts are those? Are we talking about general staff at a hospital or clinics? Are we talking about nurses being laid off? Are we talking about doctors being laid off? What is the kind of staffing that's going to be affected?
It's a combination of those, because it's a whole package of all healthcare workers. It's a combination of those, the health professional, the admin, and it's a combination of those. Take to consideration that with the COVID money that was no longer there, it also meant that the money that we used to fund the contract posts, which now they were until the 31st of March, those posts are no longer there, which is they help us, although the COVID was no longer there, the pandemic was no longer there.
Let me ask you this, just in closing, MEC, very briefly, if you can. So this money is the big issue at the moment. Clearly, it is. Forgive me, MEC, I think your line is dropping. I may have interrupted you as well. I want to ask this in closing. Hope you can still hear me. Is this something that can be fixed this financial year with Treasury, do you think? Can they get the money if you fight hard enough? Or is this a done deal until new budgets next year?
It's a combination of two. It's about, we already had a shortfall at the beginning of the year from the equitable and also conditional grants. And now with a 7.5-point increase on the wage bill, it affects us more. Therefore, the only solution is about the National Treasury, that they have to rescue us and all other provinces, specifically now on the wage bill, which is the agreements are between the national government and also with the unions, but the provinces have to absorb all of these impact.
I appreciate your time this morning, MEC, Western Cape Health MEC, Nomafrench Mbombo, as you heard, as a result of the blackouts, not able to use the video on Zoom this morning, and I'm afraid you also would have heard the line dropping every now and then, but I did try to keep the MEC on the line, and I appreciate the time this morning.